Hi, everyone. Thanks so much for having me, and thank you for that very generous introduction. It's truly an honor to be with you to discuss something that I'm very, very passionate about, which is information and information about health. The big question being how health information can be a threat to public health, and what can we do to make it more reliable and accessible to diverse communities. I want to start with a little bit of background. I've been in this space for quite a while, specifically starting in kind of the natural sciences. I was very much in the lab, very much a nerd focused on figuring out the origins of diseases, and understood that and grew to be kind of fluent in the language of it. And then the reason why I use the word language is because a lot of times that training in science is limited to just the technical skills and the understandings of things like mechanisms of action and origin and how they actually work. But talking about them is not always a skill that is trained or given to those in that kind of training. I kind of landed in it when I was spending some time at Georgetown doing graduate studies and also working in a project called Project Argus, which specifically was focused on tracking emerging infectious disease outbreaks. In layman's terms, we were trying to predict the next pandemic. So this season of COVID-19 is very much on the nose for me. I've been working on identifying some of those clues that we can pick up from our communities, whether it's red flags from the animal kingdom or red flags from the human kingdom, and the combination of the two to see if we are getting closer or closer to a next emerging threat. If you ask anybody in my space, we were not surprised by the emergence of SARS-CoV-2, the virus that causes COVID-19. In fact, for many, many years, I often said it was only a matter of time, a matter of when, not if, a global pandemic that involved a respiratory disease would happen. Again, that was not clairvoyance. That was because I'd spent so much time identifying these clues and trying to piece together the pieces of the puzzle to see what can we do to possibly slow that. Now, in the process of doing this kind of disease surveillance and disease detective type work, I learned how to speak the language of how these things happen. And the reason why that language is important is because it can be very, very scary. Infectious diseases have been around since the beginning of time. They have affected all of the living kingdoms on this planet, plants, humans, and animals. And if we don't talk about them right, I think we have the huge risk, as many of us have seen, of not understanding some really important components about our behavior, specifically about our risk behavior. Now, in the world of public health, which is what I got my undergraduate degree in, there is a concept called social determinants of health, many, many determinants. Some of them are social, some of them are physical. And some of them might be pretty obvious to you. Some of them are socioeconomic status or accessibility to healthcare or physical ability. Some of them could be pre-existing conditions or comorbidities. And some of them can be environmental. If you live in a place that has really intense pollution, or if you live in a place that has really bad infrastructure or poor quality water, those are all known determinants of health. Now, what's often missing in that list is something that may surprise you, and it's trust. Trust has been something that has been assumed that just exists, that it's deserved based on credentials, or that it can be reestablished if it's broken. And I think that that is a fundamental failure in our ability to communicate the language of science. So it's not true that trust is something that always exists, is deserved, or can be reestablished. In fact, trust should be considered probably one of the most important social determinants of health, because when it is not clear that it exists, when it is not deserved, and when it has been broken, it is very, very difficult to repair. Throughout the COVID-19 pandemic, we have been living in what we would probably call a twin-demic, an epidemic of this pathogen and an epidemic of the information about the pathogen. You've probably heard the term infodemic as well. An infodemic doesn't necessarily mean just the proliferation of misinformation and disinformation. It's just a lot of information. It's the deluge of data, of headlines, of tweets, of viral memes, of infographics, everything in between. When there's just too much of that, it makes it very, very difficult for even those of us in the science community who are kind of inclined to throw ourselves into the information vortex. It makes it very, very difficult to discern what's true and what's not, what's up and what's down, what's left and what's right, what's within scientific consensus, and what is kind of a fringe ideology or conspiracy. Now, I think it's very easy to think in binary terms when it comes to information, because we unfortunately live in a very politicized season and have had this pandemic extremely politicized. And that's unfortunate, because topics related to science and public health measures have become red and blue issues with very, very little opportunity for them to be shades of purple when they really, really are. Vaccines should not be a red or blue issue. Masks should not be a red or blue issue. Even talking about the origin, like I mentioned before, the origin of SARS-CoV-2 should not be a red or blue issue. But unfortunately, because of the climate that we are in, things have become very, very polarizing. And I think part of that has to do with the fact that our government from the very beginning did not prioritize the language of science and the emphasis on establishing and maintaining trust. Now, I'm going to bring it back just a little bit and talk about how trust is very, very community specific. So there are communities in our population that have done much worse in this pandemic because of a number of issues related to what kind of stemming from racism as a underlying condition of this country. Now, when we talk about the outcomes of COVID-19, it's very easy to make it a simplistic, well, did you die or did you not? And that's not nearly enough. We have to consider the big picture of morbidity and mortality. And we know through the data, and the data is not even that rich because we've done a lot of failures in data disaggregation, but that's a tangent for me. But we know that communities of color have done really poorly in this pandemic. They have had more infections, they've had more hospitalizations, and they've had more deaths and horrible outcomes because of a list of many of the social determinants of health that I mentioned before. But one of them that's often not talked about is the fact that trust has been broken for generations. And we don't think about trust the right way when it comes to tailoring our messages of public health and public health communication. So I remember early in the pandemic when some of us in the vaccine communication space were very, very inclined to create, a message system that would kind of complement Operation Warp Speed. And many of us were saying, well, we need to start thinking about specific community leaders, Black and Brown community leaders in particular, religious leaders, to think about tailoring those messages to their demographics, to their communities specifically, because we cannot assume that a one-size-fits-all message is going to work. For some reason, that fell on many, many deaf ears, and instead it was relied upon grassroots movements and nonprofits and patient advocacy groups to kind of take on that work themselves. I had the honor of being a part of a lot of those campaigns, but at the core of that issue was trust. Trust in the messenger, trust in the message, and the trustworthiness of the dynamic, that whole relationship. It's kind of a triad. Now, when we talk about trust, I think it's important to think about where the responsibility lies. A lot of times people think that the ability to trust relies on the person who is going to make the public health decision. But instead, that actually puts more burdens on communities who are already suffering. We should flip that narrative and think about trustworthiness as something to be repaired and something that should be actually deserved by those who do carry the credentials right now. And so how do we make messengers of public health, messengers of public health policy, trustworthy instead of worrying about making more people more trusting? And I think that comes by having science communication be at the forefront of all of our decisions. Now, I've said this many times, and I'll stand by this. This is the hill I'll die on. Science is political, but it shouldn't be politicized. We need good science to inform our policies. We need good data to give us justifications for these policies. But when we try to establish these strict barriers of separation of science and politics, that's where we get into a very, very binary world of understanding how to communicate about science. Now, throughout the pandemic, I also worked with the COVID tracking project, which was an offshoot from The Atlantic. And what we did there was specifically try to contextualize, caveat, explain, educate the topics of the data, because that's where the federal government, particularly the CDC, was kind of failing us. And our primary purpose in doing a lot of that communication and data sharing were two goals. One is data transparency, because public health data belongs to the public. And two, increasing people's science and data literacy. There is a very, very simple kind of assumption that those of us who work in science communication are either just debunking myths and doing a bunch of sassy takedowns of misinformation, but really that can be very distracting. And it can also be very harmful to folks who don't know that they have been sucked into misinformation vortexes. And it can cause more shame, more broken trust, more fear, and more doubt. But instead, giving everybody an opportunity to grow in their understanding of science and data has the opportunity of growing new trust, repairing trust that's been broken, and also possibly encouraging our education system to think about how we talk about science from the very beginning, that it's not just memorization and it's not just lab-based research. It's knowing how to talk about it in a way that maintains that kind of emotional intelligence, maintains that trust, and keeps it so that when people are having to make decisions in very scary situations, like a public health emergency, like a pandemic, it's less overwhelming. So going back to what I was saying about our work at COVID Tracking Project, when we say that data belongs to the people, a lot of times people will ask me, what was one of the biggest failures in the pandemic? And of course, there are many, many, many failures. But I really believe, and it's my bias showing here because I'm a data and science person, that had we been transparent about the data, our understanding of our risks, our understanding of who to trust would have been different from the very beginning. When we heard messages from the executive branch, like, it's going to disappear, poof, it's going to be gone, it's going to be a miracle, that broke trust. When we heard claims that it was going to be gone because the warm weather was going to kill it, or that certain off-label treatments, including bleach, would somehow alleviate your burdens of this disease, trust was broken. These were very, very early breaks in trust. One of the most horrible breaks in trust, which two actually I'll mention that still haunt me to this day. One of them was the kind of dismissal of masks, the kind of very loud assumption that masks weren't going to help. And then that retraction of that statement. That moment was a moment, right? But it was perceived as flip-flopping, as, not being a part of scientific consensus, making stuff up. And then a few months later, when vaccines were available, this false dichotomy that was created that now that we have vaccines, we can get rid of masks. Again, all of these were preventable if we paused and thought about how are we going to relate to the people? Who are the people saying it? And how can we make sure that they're not going to look at us and with skepticism and think, can they actually be trusted? So our work at CTP kind of continued through for about a year during the pandemic with a lot of warnings to people on how to interpret the data, on how to use the data to assess their own risk and make good public health choices, and how not to interpret the data. So much of what I do as a science communicator and working on ways to make this information more accessible is helping people avoid logical fallacy traps. And what I mean by logical fallacies are the things that happens in your brain when you read two things in a sentence or in a headline or in a tweet and you think that they're connected, but they're not. That has happened from the beginning of the pandemic. Things like masks and people getting sick. Well, are masks causing people to get sick? No, that's a correlation and causation fallacy. That kind of those ways of thinking were very preventable if people were being more careful, particularly journalists who for legitimate reasons needed to be motivated by clicks and eyeballs on their links, but could have prevented a lot of flurries of misinformation and disinformation. Now, I do think that there is a political responsibility in the proliferation of healthcare information and public health information. And I say this as somebody who was involved in government-funded public health communication. So if we go back to my work in biosurveillance at Georgetown, that work was 100% funded by the US government. And that reason for that was because the federal government was very, very interested in understanding what our threats were. And the way we had to train ourselves to become science communicators was to not dumb it down, but it was basically educating our government on how to perceive these threats, how to connect these dots, and how not to fall into logical fallacy traps. I mean, very much of what I'm doing today is for a much wider audience. But 10 years ago, I was doing it for a very niche audience that needed to understand, okay, what do we say about a bunch of pigs getting sick on a farm in Mexico? Well, after a few, connected events happening, like farmers getting sick and the pigs getting sick and hospitals starting to fill up, That was our ability to identify the emergence of the 2009 H1N1 pandemic. Think about what that would have done today if we had that system in place where we were explaining how to read headlines, explaining how to connect the dots between animals getting sick and farmers getting sick and hospitals filling up, and our ability to say, hey, this is something we should look out for. But instead, if you look at the timeline, and I was just looking at this the other day, just from reminiscing from COVID pandemic times, we didn't declare a pandemic until March 13th of 2020. I received an email about a pneumonia-like disease in Wuhan on December 31st, 2019. Those 3 months where we could have been more prepared in talking about this, in preparing messages, in helping people understand things like threats and risks, could have probably prevented our failures in testing, our failures in telling people not to stockpile masks and PPE and gloves, et cetera, and toilet paper and all the other things that were impossible to buy early in the pandemic. But it also could have established trust from the very beginning in the federal government that the federal government was going to be able to respond to this in ways of preparedness through providing things like tests, in ways of preparedness by providing things like masks, and even providing economic and financial and emotional systems to care for people in the context of things like isolation and quarantine. I really could talk about this for a very, very long time, because I feel so passionately that the lessons that we have learned have come at an extremely high cost. We are now on our 3rd year of this pandemic. We are approaching 1 million deaths, which we will likely hit in the next few months here in the United States. And that is deeply traumatizing to me as somebody who works in a space that when public health is trusted, when public health is funded, it's invisible. And that's where I think we have to increase now, because of our failures, the visibility of public health. How do we increase the visibility of public health so that it's not just an afterthought, not just in a public health emergency, but in all things? If public health is visible to folks, if it is now on the forefront where people know that the public health department does more than just think about things like water and sanitation, that it can actually reduce things like social determinants of health, accessibility to health, people's, things like vaccine and testing deserts, which means it's, hard to access those resources. Things like reducing comorbidities and things like reducing environmental risk factors. I mean, in public health, we've been saying for many, many years that zip code is one of the most obvious indicators of public health outcomes. But if public health was visible, and if it was funded, and if it was valued, how different could this pandemic have been? How low could those numbers have been? I mean, hindsight is 2020, which is why I'm excited to prompt you all to help me think about solutions in ways that we can increase the accessibility of public health communication, of reducing the risk of trust being broken and not easy to reestablish, and also creating solutions so that it's available for all communities, so that we are not having these disproportionate burdens of something like a preventable disease affecting this whole country. I'm going to stop there. So now that we've talked about a lot of the ways in which we failed our communities in creating accessible and trustworthy avenues to receive information, I would love to invite you to help me think about what are some tools that we can develop to alleviate these problems and to create good solutions for everybody. I want you to think very creatively here. Platforms, plans, strategies, products. I'm talking about everything as specific as it could be social media content, it could be influencer campaigns, it could be websites that are not affiliated with governments. If there's distrust in the government in your community, think very, very specifically about responding to some of the pain points that you've identified in your community that can help make sure that good and reliable health information reaches everybody. I'd also like for you to think about the voices that are most underserved in your process of planning. Things like affordability, things like accessibility. One of the things that we prioritized even at COVID Tracking Project was things like digital accessibility, which is often not really thought of when you think about things like data and data visualization. We prioritized things like alt text. We had so that it could be read out loud for those who are hearing impaired. We had things like things were searchable without having lots of like fancy things, hover things on your website. Things were easily downloadable into CSV format. So it wasn't behind paywalls. It wasn't behind some sort of weird script that you had to run. You didn't have to be too tech savvy to understand it. I want you to think that any person with any degree of computer, any degree of speed of internet, any degree of education could get this information and be benefited by it, so that it changes their behavior to make good choices for themselves, for their community, that they can share it widely, that it's accessible, that it's inclusive, that it's fair, that it promotes science and data literacy, that it adds dignity to people, and first and foremost, establishes this trust that we've spent so much time talking about.